Hello everyone, welcome back to my channel. Today we are going to talk about routes of drug administration. Routes of drug administration. We all know drugs have different formulations and we can administer drugs by different routes. Actually, those are the paths that drug or a chemical substance enter the body. There are a variety of routes to administer drugs or chemicals. As we all know, by mouth, by IV, or by rectal route, by lungs, we can add drugs to our body. We can consume drugs to our body. I have put a definition here about what is a route of drug administration. The path by which a drug chemical substance enters the body is called the route of administration. This is important to ADME. ADME it is a separate section that we are going to talk about when we are talking about the pharmacokinetics, absorption, distribution, metabolism and excretion. For this, we should know what are the routes of drug administration. These routes can be classified into two different things, by location or by extent of effect. Let's move on to by location. By location, how we can classify the route of administration. The route of administration is very often started as the location of drug application or the location where a drug has its target effect. For example, sublingual application is the route of administration for nitroglycerin given for an acute angina attack. By location, route of administration can be classified into three: enteral, topical, and parenteral. By extent of effect, we can classify it to the local as well as to the systemic. As we all know, local like creams and all, and systemics we inject into our body, things like that. By location, as I mentioned earlier, by location there is three types: enteral, topical, and parenteral. Let's see what is enteral. As we all know, enteral, simply as it is, it's by mouth. That involves GI tract, gastrointestinal tract. Here we divide it to four categories. One is placing the drug into the mouth. Second is swallowing to be absorbed. Third, direct gastric induction, and rectal. When it comes to placing the drug in the mouth to be absorbed by the oral mucosa, we can all remember GTN, sublingual drugs, or buccal drugs. GTN is treats to the angina. People who are having angina can save by GTN. We put the drug into the sublingual place to the immediate action. formulations can be tablets, lozenges, gums, etc. It can be feel an unpleasant or bitter taste to the patient, unable to give large quantities of drugs, of course, because sublingual places can't put large doses of drugs. When we are talking about the swallowing to be absorbed, it's the half of drugs are swallowing things, tablets, capsules, elixirs, syrups, suspensions, solutions, all those things. Of course, as we talk about earlier, medications that given sublingual can also be swallowed. Liquid doses can be swallowed more easily, especially when it comes to children. Pediatric drugs sections, we are using solutions, suspensions, syrups. Direct gastric introductions using a tube through the nose. Actually, NG tubes are used in these locations directly put drugs, so as well as foods into the stomach. When it's come to the rectal route, when it's come to rectal routes, we can the popular one is suppositories. As you all know, when the people can't take drugs from mouth, we use rectal route. In rectal route, we can use creams, ointments, enemas, etc. Also, suppositories are formulated to melt in the rectum at body temperature by reducing the active drug. Suppositories are most commonly used when patients are continuously vomiting. We can't give drugs to them to be swallowed, so we use rectal route. Here the key thing is the rectum has a rich supply of blood that will lead to direct absorption or the quick absorption of the drug. There are several methods when rectal administration is preferred. As I mentioned earlier, an oral drug is destroyed by acidic fluid in the stomach. An oral drug is too readily metabolized by the liver and eliminated from the body. An oral drug is a gastric irritant, or taste is unpleasant, or patient is unconscious. We can't give drugs to be swallowed when patient is unconscious. It can be a life-threatening thing. Before move on to the topical, I would like to mention some extra things that are not in my slides. Actually, what are the advantages of oral route and disadvantages? I would like to mention few things. Advantages are obviously it is convenient, safe, and relatively cheap. Self medications are possible when it comes to the oral route. But there are few disadvantages also. It can be a delayed onset of action as the dose form must dissolve before absorption. Of course, when we are going to the deep pharmacology stuff, we know we are going to learn about bioavailability. Actually, oral route bioavailability is less. Of course, the oral route is slow and erratic absorption, destruction by gastric fluid. Drugs like insulins can't take by oral route, things like that. Let's move on to the topical section. Topical refers to external applications of a drug, either directly to the surface of the skin or to a mucous membrane. Topical application produce local therapeutic effect and less adverse effects. Skin. Skin is the main topical route. By skin, we can add drugs directly as well as by transdermal. As you all know, transdermal patches we all are using. Today, that is really popular as an contraceptive patches. Drugs that apply directly to the skin by rubbing in are usually used for their local effects. We can use powder, paste, lotions, liniments, creams, etc. These are used for the skin disorders such as psoriasis, eczema, skin infections. Those skin infections can be viral, bacterial, fungal, everything. When it's come to the transdermal administration, delivers a steady level of drug to the bloodstream via patch. As I mentioned earlier, we can use plasters and this also. Here, skin acts as a barrier and absorption occurs slowly, allowing therapeutic effect to last for 24 hours and up to 1 week. It is actually a slow effect as a prolonged drug action. Here, its first pass metabolism is avoided. When it comes to the mouth and pharynx, lozenges, mouthwashes and gargles are used. In ear root, solutions, suspensions, ointments are used. We all know we use gut-A ciprofloxacins to ear infections. When it comes to the eyes, we can use solutions, suspensions, gels, ointments, inserts also. If I give you some examples like Vigamox, as you all know, moxifloxacin, fluoromethanine. There are a lot of eye solutions. Those must be room temperatured before the application, and of course when it comes to the eye, those solutions should be sterile. Sterility is must when it comes to the eye drugs. When it comes to the nose drops and sprays are used. Drops, as an example, betamethasone drops, and sprays, beclomethasone sprays are used in nose by nose. Lungs, when we all know when sprays, metered dose inhalers and powders are commonly used as Acidin MDI, Beclate MDI, etc. Vagina is another route that used for the topical applications. There are tablets, suppositories, pessaries, creams, ointments, powders that use by vagina. Vagina route is preferred for cleansing area, contraceptions as well as for hormone replacement therapy. Urethra is also used nowadays as inserts and suppositories, also gels to treat incontinence and impotence in men, as well as penile catheterization. More the parental route of drug administration. There are a lot of pathways as IV, IM, SC and ID. IV intravenous, IM intramuscular, subcutaneous and intradermal. If we are going to discuss about more details about IV intravenous, the route of administration bypass the alimentary canal. Parenteral preparations are usually solution or suspensions. The IV route is the fastest method for delivering systemic drugs and is preferred in an emergency situation. We can know when it comes to the bioavailability, IV routes gives 100% bioavailability. It goes directly into the blood circulation. Therefore, a desired blood concentration can be achieved. The drug is administered as bolus or infusion slowly. When it comes to the IM, most of the injections and vaccines that used for the how I can say used for the immune in order to increase immune administered by IM. Compared with IV route, IM administration is more convenient to deliver medications. Drugs can be injected to any of the large muscles such as the deltoid. Absorption by the IM route is unpredictable and onset of response to the medication is slow because we are not inserting it into the bloodstream. It's to muscles. IM route is unpredictable and onset of response to the medication is slow. When it comes to the subcutaneous, drugs are injected into the loose subcutaneous fat, which is rich in nerve supply and poor in vascular tissues. Subcutaneous absorption is low as a prolonged action is observed. I can give a few examples as adrenaline, epinephrine or heparin are used by subcutaneous route. Intradermal drug is given within the skin, actually within the dermis, into the capillary-rich layer just below the epidermis. We used it for local anesthesia and as well as to the diagnosis test, BCG vaccines, skin allergy sensitivity testing, such as those. Other parenteral routes are that I didn't mention here: intra-arterial, intraperitoneal, intracardiac, intramedullary, and intraspinal. Let's move to the factors influencing the route of administration. There are few factors that influence to the route of administration. I'm not going to talk about all of them. Let's talk about few of them. Obviously, physical and chemical properties of the drug are influencing the route of administration. Examples I can give: solid, liquid, gas. Those are influences solubility, stability, pH, half-life, all sort of things in a drug. When it comes to the solutions and suspensions, those are work faster than tablets and capsule. As you all know, inside of the tablet and capsule, there is drug. When we are swallowing the drug, our gastric juice should be able to uncover the tablets or the capsule in order to take drug. But when it comes to the solutions, we are putting it directly into the gastrointestinal tract. Only the lipophilic, that means highly lipid soluble drugs such as nitroglycerin, can be formulated for sustained release by a transdermal delivery system. The second one is the onset of action for the desired therapeutic effect. Actually, drugs injected or infused directly into the bloodstreams are carried immediately throughout the body. As I said earlier, it contains 100% bioavailability. Third one is the duration of action, or the length of time a drug gives the desired therapeutic effect. Injection to the muscles and skin lasts longer than injection directly given to the bloodstream. It lasts longer. But the bioavailability is a different thing. A controlled release oral tablet may last long compared to the same drug in the immediate release formulations. Fourth one is quantity or the amount of drug required. When IV infusion is a better route to deliver a large quantity of drug, oral can be cannot be a preferred delivery method. Lastly, I mentioned here first pass metabolism on the drug. Most drugs given via the enteral route are well absorbed in the intestine. However, only a proportion of the drug reaches the systemic circulation. As I mentioned earlier, it's contain a low amount of bioavailability. The reason to this is the first pass metabolism in the liver limits the action of drug. However, some drugs such as morphine and propranolol may still be effective orally because of active metabolites which processes the pharmacology action of the parent compounds. I'm not going to talk about more about first pass metabolism here. We will talk about in my further lectures. Thank you and subscribe for more.